Hey there, this is Dr. Scott Warden, the TOS guy, and we have had a little bit of a break, and now we are lucky to be back with a bang. We are really lucky today to have Dr. James Marcum, a renowned cardiologist from the southeast of this country who has a broad CV, and I'm going to try and encapsulate it. Dr. Marcum trained at the Medical School, University of Texas. He did a fellowship at the University of Kentucky, and he's been 30 years in practice in cardiology. The last 20 years have been with the Chattanooga Heart Institute. He specializes in studying healthy lifestyle and disease reversal. Rather than a lot of cardiologists you may have heard of who do interventional procedures, he is also focused on how we prevent patients from getting to that point. He's the speaker and director of the Heartwise Ministries. He's a man of faith, and I want to promote his YouTube channel, which is Biblical Prescriptions for Life. I've watched several of your videos, Jim. They're beautiful. They're well intended for lay people as well as medical people. And they always have an underlying strength as you demonstrate through your faith. And I really appreciate that. Jim was named as one of the most influential physicians in America by USA Today, which is quite an honor. And he has left us an email address. We'll put it up at the end of our show so people can contact him. Jim, thank you so much. We know you're here because of Jake, who was in one of our last videos. Take it away.
Yeah. Well, Scott, thank you for having me. And also thank you for this forum when we can reach out to all of those out there that might have questions, that need support for this thoracic outlet syndrome. And I got really interested in it, of course, after Jake experienced the venous compression from thoracic outlet syndrome. We'll get back to that later. So a lot that I've learned that I've applied from cardiology and now moved over to help those, including my son, that have thoracic outlet syndrome, especially the venous variety. But these suggestions and things we talk about tonight will also help the neurogenic form as well as the arterial form, which as a cardiologist, I tend to see the vascular more than the neurogenic. So, but the principles should hold true. And I want to be not only available to your audience to help answer questions through my email that I'm going to give, but also to help them with emotional support, with spiritual support, and just letting everyone know that we all recognize that this is a problem, a chronic disease that might not have the prevalence of some of the disease with lots of randomized double-blinded studies that have been done, but it's a growing, and we're at the sort of early end on a condition that I think is going to be diagnosed more and more, and it's going to come to the forefront, and people are going to need resources. So we want to be not only a resource that will give support, but also that will give strong medical advice. So with that, I've done lots of talks through my years, and I used to throw up all these PowerPoints and all these fancy stuff, but I found out in talking to people that some of it's just overwhelming. There's too many words, too many phrases. So what I'm going to do in our time together is I'm going to try to give each and everyone a basic framework to understand the endothelium and how it interacts with thoracic outlet, and give you something that you can hold on to for a long time. And then if you have more scientific specific questions, then we can go further in the future. But to accomplish this, I want everyone to hold on to a few key phrases. And when we hold on to a few key phrases, is what happens is we develop these neurosynapses in our brain. So you might not remember anything, but if I can get you to remember a few words, that will trigger the discussion we have tonight. So a week from now, a month from now, you won't say, oh, I watched a podcast, I can't remember a thing that was said. No, these words will actually trigger this memory system to come back. So let me give you those words. I'm going to give it now. And when we finish, I'm going to ask each one of you in your mind, and you too, Scott, since you're here with me, if you can remember these key words. The first word or phrase that I want everyone to remember this evening is prolonged exposure. prolonged exposure. And we're going to come back to that. The next phrase I want people to remember is less is more. So we got prolonged exposure, less is more, and the last key phrase is highway. So I think we can remember those. Prolonged exposure, something over and over again, long periods of time exposed to something. Less is more, I think we can remember that, and highway. Those are the key phrases, and we're going to weave this little discussion around those phrases. And when you hear those phrases at the end, it will trigger your memory system to remember a few of the key points that we talk about today. So first, I'm going to talk about the endothelium. And then after we discuss the endothelium and get a feel for that, I'm going to come back around to how the endothelium affects this thoracic outlet syndrome and how we can apply our knowledge to improvement of this condition. So I'm going to pull up a blood vessel right now for everyone to look at. Okay, there it is. That is a very big blood vessel, bigger than anything I have, might be the size of my aorta right before it bifurcates into my iliac arteries. So if you look at that very carefully, the very inner lining of that, the very inner lining about 1 cell thick, and I'm going to put it up real close to the screen there, that inner lining, the light lining there of this blood vessel. Now, remember, when I say blood vessels, we have arteries. This is an artery. We have veins as well, and they all have this inner lining called endothelium. Endothelium. So the endothelium is a 1 cell thick that goes around all of these tubes that go out throughout the body. So all of these tubes that go out through the body, that is like a highway. Keyword, highway. So this endothelium is the inner lining, and just to put it in perspective, it's the largest organ of the entire body. Everyone hears about heart as an organ, liver as an organ, lungs, but how many people feel like endothelium is an organ? Well, it's an organ that's like a highway. It goes everywhere. If you measure it, it's about 60,000 miles of highway with this endothelium lining it. How many cells? Well, it's been estimated about 1 trillion cells that's lining these. Remember, this 1 cell thick lining the arteries and the veins. If you, in perspective, you could wrap the endothelium around the world, the earth as we know it, 4 times. 4 times. It weighs about 1 kilogram, 2.2 pounds. So this is a pretty impressive organ. So why is it so important to me? Well, heart attacks, strokes, disruption in kidney functions, all of this is the cause of this disease is endothelium. And when the endothelium malfunctions, guess what we do? We have a symptom. It might be a heart attack. It might be stroke-like symptoms. And when we go to modern medicine, what do? Well, we're great at treating symptoms. We can squish the damage in the endothelium with a stent. We can bypass it around it with an arterial conduit. We can even go up in the brain and clear out some of the cloggedness in the endothelium. But the question is, does that treat cause or just affect? So that's what's got me as someone that likes to reverse disease into learning more about the endothelium. Not only is things damage the endothelium, but there's genetic influences on the endothelium. So if we understand a little bit about the endothelium, this is going to help us when we get back to the thoracic syndrome. Because remember, when we have this highway that has prolonged exposure to damage, and we're going to talk about the damage. So prolonged exposures can damage the endothelium. Prolonged exposures can help the endothelium, this highway. And sometimes we're going to find out that sometimes the things that we are doing in life, less of it ends up being more as far as the endothelium is concerned. But the endothelium is the key in preventing heart attacks, treating strokes, preventing kidney disease, and also helping with the thoracic outlet syndrome. Now, the stress to the endothelium from the thoracic outlet syndrome is much different than the stressors that we see from a heart attack, a stroke, or other things, but they can all apply and be sort of added together as we talk about it. So the function of the endothelium, both the endothelium that goes around arteries and veins, it's four big functions. One is it's a highway. So on this highway, the highway determines what gets off the highway and what gets in the highway. So if the highway is clogged up, things can't move in and out. If the exits have problems, things can't get out or in. So this highway is very important. So it's very important for this word called metabolism. So the metabolism is what the body brings to keep the cells functioning well, oxygen, nutrients, but it's also important in getting rid of wastes. So that's what it does. So things got to go in the highway and in and out of the highway and be transported effectively for the organs to work well. So that's one important function of the endothelium. When the endothelium doesn't work, we don't move oxygen, we don't move waste, we don't move energy. So that's very important. And it affects not only the endothelium of the heart, but the endothelium that goes out to the arms throughout the body. It's very important in hemostasis. So if you have blood clots and things that damages this highway, the endothelium gets clogged up. And here's an example of what I see every day is fat gets in the endothelium. See how it clogs it up? It makes it more likely to clot. And of course, when it clots, the metabolism is disrupted. When the metabolism is disrupted, the organ that it goes to malfunctions. In a heart, it might be something like a heart attack. In the brain, it might be a stroke. In the endothelium of the arm, it might be swelling. It might be blood clots as well. So it's very important for hemostasis. The third function of the endothelium is it affects the immune system. So you've heard the word inflammation, white blood cells. Well, when this endothelium, this highway is inflamed, bad things happen. So this is an example where less of the immune system being turned on in the endothelium is better because we have less damage to the endothelium, which disrupts the exits, which hurts metabolism, things getting in and out of the organ that it's serving. So that's some key things about this. And then the last thing that the endothelium really regulates is a term called angio, which means blood vessel, genesis, which means growth. So the endothelium directly helps blood growth of the organs. So the endothelium disruption is important for things like cancer, helps blood flows. When the heart's damaged, we want to enhance the endothelium so we can get collaterals growing around to feed that organ to make that highway more efficient. So I think it's important for us to have a basic understanding of the endothelium as we talk about things that hurt the endothelium and things that help the endothelium, and then as we make the jump to how it can help the thoracic outlet syndrome specifically. So if we think about this highway, okay, this endothelial highway that goes everywhere, a couple things we don't want to have things that damage the highway, that hurt the endothelium. Because when the endothelium's damaged, we've already talked about the metabolism is messed up, can't get energy in, we can't get waste out, we get blood clots, we get inflammation, and we impair the growth of new blood vessels. So things that damage it, and remember this damages endothelium everywhere, in the arteries and in the veins that go to the vessels that supply thoracic outlet syndrome, especially the arm, as well as the ones that go throughout the body. And remember, if the endothelium damages the heart, the endothelium is affected by a bad heart. We don't get as good blood flow. We don't get as good oxygenation. So everything in the body is interrelated. So anything that you can do to help the brain, the heart, the lungs, is going to help the endothelium throughout the body, including the endothelium that is damaged from thoracic outlet syndrome. So with that said, the first thing that damages the endothelium of all of it is toxins. Some of the toxins that I see quite a bit are things like drugs, cocaine, cigarettes. We've all heard about those toxins. Some that we might not have heard about is amphetamines. Amphetamines can damage the endothelial linings. Things like fat. Too much fat damages the endothelium of the heart as well as all blood vessels. Remember, our endothelium wasn't designed to see large amounts of fat. And unfortunately, if you eat too much fat, the fat is stored somewhere. And it can be stored in the linings of the blood vessels, both in the heart and to a lesser extent in the veins. Sodium. Things that are high in sodium damage the endothelium everywhere. Well, how does that happen? Well, usually sodium increases blood pressure. Any type of prolonged pressure, prolonged exposure to something damaging, guess what? It damages the linings, which causes it to malfunction, both metabolic, hemostasis, immune function, and angiogenesis. So just having too much salt via blood pressure mechanisms can damage it incrementally. So for certain things like toxins, certain things like fat, certain things like sodium, less is more. And prolonged exposures damages this highway. What are other things that we see damage it? Processed sugar. That affects your insulin, diabetic mechanism. So that's another thing that can damage the endothelium. Not enough oxygen. You hold your breath long enough, you run out of oxygen, the endothelium is damaged as well. What are some other things? Well, there's certain genetic things in our body that we have no control of, and it happens through fancy genetic mechanisms like methylation that damages and cause mutations where we damage ourselves genetically. So there's many different things that can damage the endothelium. Recently, we've heard of the COVID-19. So the COVID-19 itself, via the spike protein, damages the endothelium because the spike protein binds to this ACE receptor, disrupts it, and it causes specifically clotting, metabolic damages, and inflammation. And we've seen a lot of blood vessel and organ damage, not only from the COVID, but also from the spike protein that we're seeing in the vaccines. So there's many different things that damages this endothelium, this single vessel lining, this large organ, trillion cells that go throughout the body. Now, I hope you're following me so far. But now let's get back to the damage from thoracic outlet syndrome. Well, the damage to thoracic outlet, some of these others are indirect damages. But when we have thoracic outlet syndrome, specifically, the blood vessels are usually damaged secondary to trauma. We have the trauma of an outside not being able to move blood and blood vessels through a small opening. Some of that trauma is by repetitive activities. Some of it's genetically induced by an extra rib. Some of it's genetically induced by a lot of pectoral muscle being so big that it traumatizes the blood vessel that has a limited space genetically to move through. And likewise, it damages the neurovascular bundles as well. Well, the nerves are involved in all of this because guess what? The endothelium and the arterial system in the thoracic outlet syndrome supplies and takes care of the nerves. So by enhancing the endothelium, you can enhance the nervous damage that also is frequently seen with thoracic outlet syndrome, which is hurt when we usually traumatize that area. So now we talked about some of the damages. Let's talk, we talked about prolonged exposures to these bad things. Less of certain things are definitely good. And we talked about this highway. But now, what can we do to improve endothelium that has been damaged everywhere, and to also improve the endothelium, specifically of the veins and arteries that are supplied to the nerves that the thoracic outlet syndrome specifically affects? So first, I want to talk a little bit about nutrition. Okay, we talked about things that hurt the endothelium, but the endothelium is regulated by a very special a regulator called nitric oxide, NO. And that a few scientists a few years ago got a Nobel Prize for discovering nitric oxide. We haven't known about it very much. So nitric oxide is, for instance, when I give a person nitroglycerins, I give them nitrates. And nitrates in the body via an enzyme gets turned into nitric oxide. Nitric oxide is made from an amino acid called L-arginine, and through nitric oxide synthase, it develops nitric oxide. So basically, nitric oxide is good. We want as much as we can get. Why is that? Because nitric oxide is a key regulator to make the endothelium happy. So this highway, nitric oxide is what keeps it healthy. It's like the crew that keeps the road running good, keeps things good so things can move in and off this highway. So when we talk about nitric oxide, there's certain foods that enhance the production of nitric oxide. And we can't measure nitric oxide because it goes away so quickly. It's in and out quickly. So we can't really measure it directly. So we measure it indirectly by the good that it does. So nitric oxide makes the arteries get bigger, makes them get bigger. It also decreases clotting in the vessels. It helps with angiogenesis. So it does lots of things that's very good. Foods that increase nitrates in the body, or L-arginine, will increase the production of nitric oxide. So we see that in greens. Greens are great, and I like to eat some green salad every day. The specific greens that help me are things like spinach, and arugula has some of the highest nitrate composition of all the greens. Studies have been done on beets and nitric oxide, nuts. Any nutrient that has L-arginine in it has a potential to increase nitric oxide. So that's one type of nutrient that enhances the function of the endothelium. Another one is antioxidants. So antioxidants, you see them in berries and different fruits. Antioxidants are help repair some of the damages that's done to the DNA and helps us with inflammation. Now, studies have been done on the endothelium. There was a Harvard study that showed that vinegar helped the antioxidants. We know that regular movement, just blood moving through the endothelium, helps produce nitric oxide. Different vitamins like vitamin D and vitamin C helps the blood vessels as well. And it helps with elastin and collagen. Those are the basic substrates that help the arteries get bigger and smaller. So studies also on the endothelium at large have shown that things like ginger help the endothelium. Water, if you're dehydrated, that hurts the endothelium. Water helps a lot. Another thing that helps is a substance, I don't know if I mentioned it, called ginger. Ginger helps clotting. It decreases a chemical called fibrin, also decreases inflammation that we see when the endothelium has been damaged, whether it be from trauma or toxins. Just to give you an example, one serving of greens, let's say one serving of arugula, will give your endothelium function as measured by some of these metrics that we talked about, dilatation mainly, a 6% improvement in function by eating one serving of greens. So if we have 5 or 6 servings a day of these healthy things and do things like drink water and move, we can enhance the endothelium 6 times whatever. And then if we avoid some of these toxins, we can improve that. So less is more of certain things, but prolonged exposure to good things also help this highway out. So I hope that gives you a basic feeling for the endothelium. So now that we know a little bit about that, let's talk about the endothelium and specifically the thoracic outlet syndrome And some of the things that I recommended to my son when he had the endothelium damage that he had, some of the things that he's adopted in his life. Now, before we do that, I want to ask Scott if there's any questions or anything that hasn't been clear thus far that we can sort of sharpen up for everyone that might be listening today.
Well, first, let me say that I just learned a lot. Your method of taking this complex material and breaking it down into simple, easily understandable bits is great. Again, I'm just going to say your YouTube channel, Biblical Prescriptions for Life, I recommend it to everybody. You talk about a lot of subjects, and you do it in the same way. So that's really great to listen to. It's all clear so far, and I'm feeling healthier just thinking about how I'm going to change my diet starting now.
Well, another thing that I say everyone out there is remember, less is more. So even though we learn about this, but we want to incrementally put things together. Because remember, the body is complex. And some people, if they move too fast on anything, they have sort of stress in the brain. And stress in the brain is just as dangerous as anything else. So you got to move at your speed, not stressing your inner self. So remember, if eating and nutrition stresses you, you might lose some of the benefit. But if you can do that and be happy and empowered, then you have the best of both worlds. So I tell people to take one step at a time and try to get more exposure, prolonged exposures to good things, and realize that prolonged exposures to bad things, the less is more, and just build on that. And usually as you do that, the endothelium of everything, including the brain endothelium, starts to work better. So now let's get to the thoracic outlet syndrome. And remember, the thoracic outlet syndrome, it's very hard to diagnose. And luckily for us, the Dr. Worden has developed some state-of-the-art imaging tools. So if you have symptoms of thoracic outlet, you need to get it evaluated. Because once a person knows they have a problem, sometimes that serves as the motivator to get them to learn and apply things. Now, I found that very true to myself and Jake. We didn't talk about this or learn about this when we didn't have a problem, but a symptom and a diagnosis took up to a heightened awareness that motivated us, that stimulated us to sort of make these changes and learn about this subject and start to support each other as a community. So I think if you're having symptoms that you can't understand, especially in your upper extremities, of course, the venous system is pretty easy to diagnose. The arterial system is pretty straightforward, but most of the thoracic outlet is from neurogenic compression from trauma. That is very hard to diagnose. And luckily, we're getting protocols that we now can image some of this and get a feel to whether that might be your diagnosis. And I want to encourage everyone, if you think you're having problems with this, talk to your doctor, talk to your provider. Dr. Scott here has great resources to help you make the diagnosis. And then once you make the diagnosis, then you can start treatment, whether that be decompression, improving the endothelium function, physical therapy. Everyone sort of has a different path. But after the diagnosis has been made, the treatment has begun, you want to maintain. And you want to maintain even though there might be some permanent damage done. My son, Jake, who you've heard the story before, is living with venous damage from the thoracic outlet syndrome. He will always have some residual damage to the veins. He can improve it and he can keep it from getting worse. And in some instances, we can take away the disease to some extent. But to some extent, unfortunately, we have to live with the consequences. But that doesn't mean we can't do well. That doesn't mean we can't be happy. And that doesn't mean we can't thrive. And that's why I started, learning about Jake's form. And in Jake's form, he had trauma from blood clots. That damages the endothelium. The trauma of the blood not moving caused the blood clotting, but subsequently the endothelium throughout the whole system, because of that increased pressure, was damaged. And we've talked about endothelial damage. When it's damaged, it wants to clot. When it damages, it can't move waste in and out. That's why we have so much swelling. That's why we have pain. We can't get nutrients in and out as well. So it's a major problem when this has been happening. So the venous endothelium cells is a little bit different than the arterial venous endothelial cells. The endothelium of the veins are very important in vascular growth. So if we can keep that endothelium healthy, that gives us the best chance to grow smaller capillary beds and smaller sub vessels that also have endothelium that can enhance waste removal. And we see that in athletes. When they exercise, they hurt. They can't get rid of their muscles, make lactic acid. They can't get the lactic acid out of there. But enhancing the endothelium helps us remove this lactic acid and this waste so we can recover better, so we can exercise longer. In patients with thoracic outlet syndrome, with the venous or what's the neurogenic, when we talk about exercise, prolonged exposure to exercise, sometimes less is more. And each individual has to figure out how much they should do before they cross the line about what their endothelium system can take care of. And that's individual, but muscle aches, muscle fatigues, swelling, neurogenic symptoms, that's telling me that whatever you're doing, we have to do less of that and find a remedy so you can do more of that. Part of this is making the endothelium better. Part of it might be physical therapy. Part of it might be decompression of the part that's being squished. Part of it might be this improving the endothelium through nutrition. So in Jake's situation, he didn't want to do this. He was a teenage guy, you know, he liked to eat pizza. But I had to say, Jake, fat, sodium is not the best thing. So we want less of that. Okay, we want less prolonged exposure to the toxins. We want to improve this highway. So we didn't hit there in one day. We said, let's do less and let's start eating greens. So Jake started gradually in his recovery. We enhanced his greens and antioxidants to 5 to 6 servings a day. And guess what? Inflammation went down. Endothelial growth factor increased. We had higher levels of nitric oxide, which made the arteries bigger, which made them able to get waste out so he could exercise more without lactic acid buildup. We can improve oxygenation delivery. We can improve a waste product, carbon dioxide exiting, just by improving his nutrition and just by avoiding toxins. Then we had the appropriate amount of activity. Less is sometimes more. So we figured out, and it's each individual, how much is too much for this vascular endothelium to handle. And we figured out whenever the arm started to swell, too much. Whenever we had pain, too much. And it was a challenge to talk to his trainers, his coaches, who went to the old football school. Well, you know, no pain, no gain. You know, let's, you know, you're tired, but let's run an extra lap. But in this situation, that was actually making things worse. And when things got worse, guess what got damaged? The endothelium. So when the endothelium's damaged, everything we talked about earlier gets damaged. We can't move waste in and out. We have inflammation, which damages it. We turn down angiogenesis, and we create clots going to the body. So that happens at some level whenever we damages the endothelium from overuse. So getting the appropriate activity level was very important for Jake early on. And as we've gone on, the activities have gradually increased and improved. But it took decompression, fixing the clotting. It took a lot more than just maintaining the endothelium, even though that was one vital component of a very dynamic system. So last thing, we really wanted to concentrate on hydration. Water was so important. And I can't estimate, you know, how important drinking water is. Here I'm talking and my mouth's getting dry. Well, if your blood vessel's dehydrated, guess what? Inflammation. Guess what? This highway constricts. We can't get things in and out as well. So things clot more. So whenever we're dehydrated, the brain makes adrenaline. Adrenaline and cortisol cause clotting, damages the endothelium, is a stressor that can even get back to our very genetic core, causing methylation and mutations. So we don't want any type of stress, either mental stress or dehydration stress, when it comes to improving endothelial function. Now, some things that people didn't think about that when we started talking about this is I'm really impressed, at least in the venous form, of improving endothelium by compression, appropriate compression. When I have patients that have venous insufficiency of the legs, varicosities, swelling, I like to put some low amount of compression on the veins. Remember, if the veins are dilated, guess what? The valves can't close and they can't move things out. So this is very much a physical thing. But just by putting a little compression on it, it keeps the veins from dilating. Other things that we don't want too much of that would cause the veins to dilate too much is too much heat. Too much heat would dilate the veins as well. So my patients that wear compression stockings on the lower extremities to increase venous return, I also think it's very important for athletes to help venous return by some type of compression sleeve, okay, if they can wear this. In the old days, before we increase venous return, that method, people used to raise their arm above their head for prolonged periods of time to help get the fluid out of the arm via gravity rather than the valves that are inside the veins. So I found that is a very important adjuvant to improving venous insufficiency and the endothelium during this whole process. So remember, better endothelium, better waste removal, better flow, less clots, more oxygen, more angiogenesis to grow some small vessels that can help you out here. And all of this, if the nerve is damaged, the better the nerve is treated with nutrients and waste removal will also help the nervous form of thoracic outlet well. So that brings me to specific medications, okay? I get asked that every day. Are there specific medication and is there evidence-based data that will help? We talked about a lot of natural things. We've thought about toxins that can hurt the body, nutrition aspects that can hurt, nutrition access that can help us. Well, remember that prolonged exposure to bad things is not good, and less is more of certain of these bad things. And we want to remember that this is a highway that moves throughout the body, taking things in and out all the time. So if we think of it as a highway that needs to be maintained, what are some things that we've already talked about? What are some specific nutrient medications that we can take? Well, the one that's been out there a long time that I use in my patients with venous insufficiency that we used in Jake. Now, if you have clots, you're going to want to take something to block clots. Simple as a baby aspirin. If you have lots of clots, sometimes in the venous form, you have to take a stronger anticoagulant. Your doctor will be the best one to know. Jake had to take one called Eliquis, but just for a short period of time when his clot burden was high. Now I have him take maybe a baby aspirin once or twice a week. When he's done damaging his endothelium for overtraining, which he still does occasionally, he can't be perfect, okay? And a baby aspirin about once a week. But when he quits training, then he won't have that problem, and I don't think I would recommend that. Is there a randomized study on the blood thinners? No, there's not. It's just common sense, I think. Now, there is random study for one thing that I prescribe called horse chestnut. And there's a study by Sutter in 2006. He reviewed 5 studies on horse chestnut. And what he says is horse chestnut is a natural substance. They use it a lot in Europe for venous insufficiency of the veins. But I also think it would help the veins everywhere throughout the body. But this basically helps the capillary walls, the smallest blood vessels, from breaking down. And it seems to help proteoglycans in the body. So it keeps the veins, this capillaries, the smallest ones, healthy. I've really never seen side effects by taking the horse chestnuts, and you can get that over the counter. It's a very safe thing to add to a regimen, but that would be an add-on, okay? It wouldn't be one that I would start with. If everything's going well, I would do the big picture items first that we talked about, and then the add-ons next. next. Now, another one that you're going to see out there on the internet a lot is one called Gotakula, Gotakula. And that basically helps by increasing collagen and elastin in the body. Collagen and elastin make up the outer linings of the blood vessels, not the endothelium directly, but the endothelium is affected by all of this. I don't think I really would go for this one because this one just is basically, it's one that increases a substance in your body called flavonoids. And flavonoids have certain chemicals in them, oxyruteins and some of them, that decrease fibrin, which is clotting, increase elastin that makes your blood vessels more elastic, which is good. But we get flavonoids in foods like apple, citrus, cranberries, flavonoids, and just that in itself, it's a better delivery system to the body. Remember, if you eat your chemistry, the body, especially the gut and the probiotics, know how to take what you need in and out much more effective than a supplement. Supplements are great if you have deficiencies. But if you get too much of any good thing, the receptors don't know what to do with it, and you can sometimes block receptors that you need. Okay, we see that a lot through the years with certain over-the-counter supplements. So if you can eat your chemistry, it's a better delivery. So I would say rather than take these as a supplement, this one we can get that in a flavonoid. So those are two medicines that we see. Now, lastly, for the thoracic outlet syndrome and the endothelium, occasionally the veins are damaged greatly. And we get these things called webs inside them, which are set up for clots. The vessels, the valves don't close. So you can't close, so you can't move things in and out. So this highway of metabolism of all the things we talked about is disrupted, that damages it, that puts stress on this endothelium that we've talked about. So in some instances, when we can now study this with imaging, okay, we can look at it. In some instances, surgeons now have the technique to go inside and repair and help. They can stitch and they tighten up these veins so these valves are not so dilated. Now, that is a rare instance. I rarely see that done, but technology's growing. It's possible. So I think the first steps is an understanding of the endothelium and the thoracic outlet. And if you think you might have a symptom of whatever it might be, see your doctor, get a diagnosis, get imaging, get help, then get early treatment, and do everything you can to mitigate long-term damage and perhaps grow these new blood vessels, enhance your endothelium so your recovery can be good. Now, the neurogenic syndrome, I have a nurse that works with me directly, and she had both sides done. She had decompression. She had decompression surgery by one of the surgeons, and and in fact, I had dinner with him a couple nights ago, and he said he'd love to talk to everyone about decompression surgery. So he might be willing to come on and talk to us and answer some questions. He did Jake's surgery. He did my nurse's surgery. She had decompression of both sides. And then immediately when she had the decompression done, she had relief of symptoms. And that was all it took. She didn't have to enhance the endothelium and do some of the things that we talked about today, because just the decompression, the trauma of that improved her symptoms. Whereas I had another nurse, doctor that works in the emergency room that had it done, and she had some relief but still had problems. But by appropriate physical therapy, movement, and endothelial help, she's able to mitigate the symptoms and live a much more happier life, because at some point there's no more surgery that can be done to help her. So she did all these other things to help her body, to help take pressure off this area, especially from physical therapy and the exercises that's done. And she is going through some daily exercises, and she admits that has helped the most after surgery. But these other things that we've suggested has helped incrementally. So each person is a little bit different. And I think, Scott, I have a question for you. The imaging can sometimes help sort through whether we're improving or not. Is that correct?
Yes, it can, but it has its limitations like every test we do in medicine. It has
But
to be used in conjunction with a good
yeah,
clinical doc who understands the disease.
but I think when you put all this together, the diagnosis is very important because a lot of people are walking around, not so much with the venous and arterial because that's so dramatic, but a lot of people are walking around with the neurogenic form and never get a diagnosis.
Yeah, and
And
you said this before very well, that the venous form is a dramatic presentation. As with Jake, the unilateral arm swelling, young, healthy person, it's got to be, I'm going to ask you about this in a bit, but for our family, it's got to be pretty shocking. The arterial form, where you just get sudden loss of blood flow to an arm, it's an
yeah,
emergency. But the neurogenic type can be very subtle, and it can change depending on the time of day, the time of the week, the arm position, the neck position. And unless you have a high level of suspicion for it, you can miss it as a doc. Part of our efforts with great people like you is to spread awareness.
yeah.
Patients don't
So,
know to search for it.
but if I had a patient that I was suspicious and I referred to your imaging, you could what would you be looking for that would key me in as a clinician that they had the neurogenic form of thoracic outlet?
Thank you. Thank you. So that's a great question. Number one, we understand, and I understand, what are the underlying causes. There's a ton of variant anatomy in this area. Everybody is built a little differently. So really, for the neurogenic type, like every other nerve entrapment in the body, we are following the course of each of these nerves that make up the brachial plexus, follow that whole network of nerves, and anywhere along its course, we look for things like lung, fibrous bands, extra muscles, bony abnormalities, and arm motion, either stretching or compression, the brachial plexus. If you put that together with the clinical findings, you have a much higher post-test outcome, in my opinion.
Yeah. And I think that fits in well with what we've talked about today because the nerves need the endothelium and removal of waste and getting nutrients just like everyone to maximize their function as well.
Well, you've given me a lot of food for thought, and people who have watched our videos regularly know that I talk about some of these things. We believe
Yeah.
there's a spectrum, which you referred to. It's not just neurogenic, it's not
Yeah.
just venous. In many patients, they can have obvious neurogenic TOS, but they have compression of those veins. And there's a study I bring up where they took dogs and they banded the aorta and banded the IVC, the inferior vena cava, which for our viewers is the large vein bringing everything back from the lower half of the body towards the heart. When they banded off or obstructed the aorta, the large artery, they found damage in the nerves of the lumbar spine. But when they compressed the inferior vena cava, just these low pressure veins, they found a completely different pattern. There was blood nerve barrier breakdown, meaning the blood vessels became very leaky, something you had mentioned about before about taking supplements to keep the blood vessels from getting leaky. I believe it was
Yeah.
horse chestnut. So blocking off the inferior vena cava, the increased venous pressure led to an entirely different type of damage. And what a lot of authorities believe is that when you compress these veins enough up here, you get internal damage in these nerves of the brachial
Mm-hmm.
plexus just because you're hitting this
Yeah.
this endothelium and you're changing the metabolic milieu, you're changing how you take waste away, and you're creating this fibrosis actually at a microscopic level within the nerves.
Wow, that's fascinating. Well, I've talked over 45 minutes, and probably everyone's a little bit bored with me now. So I want
Oh, I
to
don't think
entertain. I would be happy to answer some questions. And if there's not a lot of questions, I'm going to sort of go a little bit about personally how it's changed us, how it's changed our family, because some people might be able to identify with that and how we learn to live with it.
Jim, I think that would be really great. Not only are you a parent, but you're a physician with all this knowledge. So it's going to be very interesting for our viewers to hear how you dealt with that. So why don't you share some of that with us? How
Yeah,
did you find out? How did you feel when you found out? How did you deal with your
yeah.
position as a dad and a physician?
Well, that was hard because, you know, I was when Jake first came to me with the symptoms, here I am, I'm in denial. I don't, oh, it's maybe you just got a little rhabdo, which is sort of, rhabdo, and it's swollen. It's been swollen before. Maybe you overused it. But the second day when it was a problem, then we spring into action. And then all of a sudden, when you have a large clot burden, and that clot could go around the corner into the lung, even though that's not common, there is always a chance of a pulmonary embolism and sudden death. And when you see someone that you love so much scared, and you're a little bit scared, but you can't show this scared, then all of a sudden you fall back on your faith, and your friends and your network, and get help from people. So I'm one that, I don't know very much about things, and I reach out to help. And so I contacted everyone I could that could help me. Unfortunately, I did not know you at the time. Otherwise, you'd have been on the phone too. But I talked to every surgeon, every imaging. Now, the imaging guys that I had were pretty much, they weren't onto this. They just didn't do it. Nice guys, but they said, we don't know what to do, that kind of thing. And that was a little bit discouraging. And I said, why? Well, we don't see enough of it. Okay. That was sort of, it's not a common thing that we see. So, so I reached out to get as much knowledge as quick as we can, then saw the big picture. But yeah, it was disturbing as a parent to see your son's dreams, him being scared, and how to relate to him, but then show concern, but confidence, and relay this confidence. And something that I find very important in what I did do at disease reversal, and that's hope. Without a vision, the people perish. You have to have hope in something. Even if Jake couldn't get back swimming, is hope that this would get better. Hope that we would learn something, hope that we could help society by having this condition, hope that it would make me a better clinician from going through this with you, hope that we could use this to help other people and make other friends and support other people that are going through this. So I always wanted to try in whatever way, despite what I might feeling, give not only concern, but strength and a feeling like, we had some amount of control over what we were doing. And the trickiest part for me was timing. Jake wanted to swim. I didn't want him to swim too much more. And we remember the words from our lectures, less is more. Well, teenagers want to do more. They don't believe less is more. They believe more is more. Getting him to understand this highway that we're all on. We're on the highway. We want to be able to get on and off the highway. And then getting him to understand that prolonged exposure to disease is going to have its consequences forever. So once we got that into a teenage mind, he was a mature young man to begin with, but his growth as he went through this continued to grow. And his physician learned a lot about taking care of people. Bless her heart, surgeons like to cut. And then after the cutting, it's on your own. But there's more to it. There's what we do during to support each other emotionally. How do we get good information? Where do we go to? Where do we go to for answers? There's no journal on this. There's no society. There's not a lot of randomized double-blind studies. So that's why we have to depend on sites like this, information on people that have anecdotal studies, because it's going to be a while before anyone's supporting studies that we can do on randomized trials. It's going to be a while. So we just have to collectively gather everyone's expertise, share it the best we can. And this is the way medicine used to be done before we had, so much going on. This is how medicine's been gone for years. So we have to sort of go to the old school in this condition. So as Jake learned and we supported and we fell back on our faith and we prayed, God, we know this is happening for a reason. Just be with us, comfort us, take away our fear and anxiety, which is going to make things worse. Give us peace that you're in control. Give us the knowledge we have to take these steps as we move forward, not only in the acute phase, but what to do in the years afterwards. And that's what we're doing now, is trying to follow this longitudinally over time, get other people that have suffered this and follow them after the event, not so much in the diagnosis, but how do we take care of this long term? So Jake has developed a website called helpforthoracic.org, where he's put his story in the form of a video.
Help for Thoracic Outlet, helpforthoracicoutlet.com, is that correct?
That's correct. And he's going to add to that, try to answer questions, put some more videos of people up there that have gone through these, and anecdotally give people information, and they can see how they might apply it carefully to their situations. So that is an ongoing.
It's a great website. That's how I found you. I saw this video, a very well done video. And
yeah,
I'll tell you this. I knew the ending because talking to you and Jake, I knew the ending. But if I had been there at the beginning in your position as a dad, I know it would have been very, very tough. I think it must have taken a lot of strength to guide him through this.
Yeah, it's a lot of strength and prayer. And I realize not everyone has a great ending. And yet those people that don't have a great ending still need as much support and help as anyone else, if not more. And that's part of what we want to do. This is a forum
we can provide some knowledge and some support and some avenues for people to get more support and more answers. So I greatly appreciate you being here, and just as well as Jake. Let me have a couple of audience questions and forward them to you here. Herb, why don't you put up some of the questions we have? In the meantime, while Herb is doing that, I'm going to ask you a brief question about fish oil. Do you have much knowledge of fish oil and how that's used, how that can help our endothelium?
Yeah, fish oil is, especially endothelium that's been damaged, okay? Remember, fatty acids, fish oils, they help specifically, they help with inflammation. They decrease inflammation quite a bit. So they help in that aspect. And also, they have certain nutrients in that can also help the endothelium. So fish oil is a good thing. Too much, I can't really recommend saturated fats. There's a difference, like things like avocados and healthy oils from that, and healthy oils at some extreme can be very beneficial, especially in the inflammatory cascade. We need a certain amount of healthy oils, healthy fats for everything to function. So I think in moderation, that's a good thing. But some people go overboard. I can't say, heating things and hydrogenated things and things like that are a good thing. But in moderation, fish oil might be something that would help endothelium, especially clotting and inflammation.
Thank you. So a perfect timing for this question from Jeannie in Portland. If I could eat just 3 things that help endothelium health, what would you recommend? And then please say avocado with a smiley.
I love that question. Yes, avocados. But on that, for instance, I would start with greens. I would eat greens, okay? Find something greens, nitrates, nitric oxide. That's the substance that the endothelium really loves. So greens. Beets are very helpful too, the same mechanism. Avocados would be good because it has some healthy oils in it as well as those things. And some of those things also have antioxidant characteristics as well. Anything with vitamin C and things of that nature help elastin and collagen. Now, I know that's outside the endothelium, but that also is going to help the veins and capillaries of the body. So greens, beets, and avocados would be a good place. I would also add in some berries. I might add in some nuts as well, because nuts, of course, have L-arginine in it as well. L-arginine is a precursor to nitric oxide.
Great. Next question. Has any research been done in regards to endothelium health and neurogenic TOS? Meaning, what type of relief might I expect to have? And this is from Penny in San Juan. So I'm going to pitch in a couple. As far as I know, there is no study on endothelial health and neurogenic TOS. I would say, though, and this is something you may or may not know about, but the imaging literature clearly shows that normal people get compression of the subclavian veins with their arms up, and not statistically different from people with TOS. So there is a missing link here. something causes damage to the endothelium and allows blood clots to form in some people, even though we know lots of people get compression.
Yeah,
So it's
and
not just
I'm not aware of any specific research, but from my work in genetics, there is a genetic component here that we haven't identified with, because, why do certain things happen and everything else looks fine? Okay, so there's a certain genetic component that I don't think has been identified yet that makes more people more prone to some of these things that are happening. And it has to do with complex things like methylation on enzyme levels, at capillary levels that increase pressure, these type of things that we might not pick up with certain testing.
Do
But
you
I'm not
think
aware
it's
of
a
any research. I'm not aware of any research, and I don't think any's going to be done because who's going to fund it? Who's going to fund it? And the numbers aren't probably large enough to do great studies. So I'm not aware
do
of
you
it.
believe
I
that?
wish there were.
Yeah, I was actually part of a study submitted to the NIH, a multinational group. We had tons of surgeons and clinicians and only one radiologist, unfortunately. But I was part of that study, and we applied under the rare diseases component,
Okay.
even though I don't believe it's rare. But in the end, the group decided, and the steering committee, which I was part of, decided not to use any advanced imaging, just X-rays. And the NIH said, well, why didn't you do that? So we didn't get any kind of funding. And I really feel badly about that because we do need the numbers and we do need the research. We do not even have an accepted gold standard for the diagnosis of neurogenic TOS. If you read the leaders in the field or the people who publish the most, they kind of say, you got to trust me, and I know it when I see it. And they'll list a bunch of potential signs and symptoms, but there is no gold standard, which means when you do a study and you have outcomes, how do you guarantee that the patient population even had neurogenic TOS? So I think, as you said, it's an old way to approach it, but I think we need to really work on getting larger groups, getting more specialists, and refining it so we have some of those steps.
Right. Yeah, until you can't really do research, like you said, until you define what's the diagnostic criteria.
Yep.
Yeah. Well, I'm sorry that we don't have an answer to that question, but hopefully someday someone will do a study, but it might take some time.
Well, we're working on some things. I have some very good things coming up. I'm keeping my fingers crossed. Buddy Lee and me says, I have a chronic hiatal hernia with all of its issues, but my chiropractic pretty much under control. I guess, Buddy Lee, your chiropractor has it under control. Is that correct? With that preface, thank you. So with that preface, I still have a long time phantom pain under the left rear shoulder blade. So could this be TOS? This is where you really need a doc to be hands-on, a doc who has some knowledge of TOS.
Yeah.
We don't want to venture into diagnosis here.
I think this is a great place to see your provider and have them examine you, both a detailed history and physical, lay hands on you. That's some of the best diagnostic tools we have. And then based on that, you can bring up your concerns, and then they can say, yes, these are some things that I'm concerned about. They cannot. And then they can move to the appropriate imaging modality and see if a diagnosis can be made. So right now you're at the symptom stage. The next stage would be get a good history and physical, and then see if there's some way to make a diagnosis on what's causing a problem. But remember, pain and discomfort does come from nerves. So, but what is causing the problem with the nerves? When a person's having a heart attack, that pain's coming from a nerve too. Exactly, but the etiology is much different than it is from elsewhere in the body. So you want to get a good history and physical, and then go from there.
And
wish we could do it. I wish we could do it. Wish we could do it online, but it's going to be hard to do it just with a video. But I'm just so glad you spent time to watch tonight, and thank you for your question. there's no such thing as a bad question. And I'm just hoping that you start to feel better soon, and go see your doctor. And sometimes I know you're seeing a chiropractor, but getting a different set of eyes on it. The orthopedic guys have a different perspective. The internist guys have a different perspective. So to get different viewpoints, that might help make the diagnosis a lot more. Because I know in heart disease, when a person comes in to me with chest pain, everything is heart at first. Everything's at heart at first. And sometimes in the medical profession, we sort of look for what we deal with the most first. And sometimes we don't sometimes see the big picture. So another set of eyes and ears might be a good thing to have as well.
Well, Buddy Lee has been here before, and armed with some of the knowledge, you can go to your doc, obviously, and say, could this be thoracic outlet syndrome?
Yeah.
I have read A, B, and C. And if your doc says, I don't need you being a smart ass, get out of my office, then you need a different doc. And with
Yes.
this age of Dr. Google, patients ask me questions all the time. My feelings are never hurt. We learn a lot from patients as well. So you should be proactive and take the knowledge you've learned here and ask your doc quite honestly, could this be TOS? If you don't know, do we have a specialist you can send me to? And Jim, you brought up a great point. It's even made worse because in medical school, I don't know how much you learned about TOS. I learned this. It's just so random. In every city, in every region, we find a different specialist who's the one who knows about TOS. Could be a neurosurgeon in this place, could be a cardiologist in a different place. So I think it unfortunately falls on patients' shoulders to find somebody who's a TOS specialist rather than a specific specialty in medicine.
Right.
So,
And it really takes a team too. You have to have the diagnostic part of it. You have to have the imaging part of it. You have to have the treating physicians, and you have to have the people that will follow up afterwards. So it takes a team.
So in Jake's case, to go back,
Yes.
you saw the blood clot when it was first seen on ultrasound, and you must have bit your lip or something to not jump in and say, I know what's happening.
Jake even knew what it was. I mean, we had a lot of clot, no flow, he says, well, Dad, I don't see any color here. I mean, what's going on? I go, well, Jake, we're going to deal with that. We have a problem. And of course the sonographer, the ones that taking the pictures, can't say anything. And I'm speed dialing my vascular surgeon friend that deals with this right away. And asking for some blood thinners and, et cetera, et cetera. All the doctor part of me and the father part of me, what a conflict. I mean, you got two voices in your head going on at once, and your head's like, oh no. The doctor part says, do this. And the father part says, it's time to cry and weep and hold your son and hug him. And the doctor part says, no, I got to get some treatment going. We don't want it to get worse. And you have this inner conflict just going on right there. And of course you have people that you work with every day that's looking at you and say, oh, this is your son. How is this guy going to handle it? And you just take a deep breath and pray and just do the best you can, realizing that it's not a perfect world. And I made mistakes in the process. I wasn't a perfect dad. I wasn't a perfect clinician, but I honestly think I did the best I could under the circumstances.
Jake was very impressed with how you handled it, and you let the experts guide everything.
Yeah, well, I had to. I mean, I had to sort of detach myself a little bit to make good decisions, and I depend on other people.
You were probably up all night reading that night.
I was, I had to fill in the pieces, and what I was surprised at that time, there wasn't that much great stuff out there. I was looking for the randomized studies and that kind of stuff. And, we were familiar as cardiology with it, but we didn't see this that much. We didn't look for it either. Right. I had a few clots through the years from a catheter-based procedure, something like that, but never anything like this, when an arm was looking like it was gangrenous right in front of my eyes.
I'm going to go back to Buddy Lee, who has another question. He asked, can a therapy such as EECP help counter, if not heal, damaged arteries and veins endothelium, and is it widely available?
Yeah, I don't know about that for thoracic outlet, but we used to do it for veins in the legs to improve cardiac output to the heart. It did increase venous return. Movement does help the endothelium. Remember, we talked about how compression of veins, especially if they're dilated to the point, the varicosity type veins, with a dilated point, the valves are really super malfunctional where they can't get fluid out. So I don't know the answer to that question. And if I find out, I will certainly put it on the website and pass it on. But we're not doing it that much anymore in the South. But if you think about it, compression is some of the same principles, but it's just not compression at different intervals. But I bet you from logic that would help.
Got it. Buddy Lee and me has another question. Is long-term daily use of nitric oxide stimulators such as L-arginine and L-citrulline safe? Right up your alley.
Yeah, yes. Nitrates that come from food sources are safe, okay? Supplements, don't know about. But I have had people that, I use this to reverse coronary artery disease as well and to improve the endothelium. I have people that eat, 2 pounds of greens a day and they've never had any their bowel movements are great too, but they've never had any long-term sequela to my knowledge. I'm not aware of any long-term studies that show great amounts. Supplements, who knows? They haven't been studied. But the natural forms, for instance, elephants have some of the healthiest endothelium in the world. And all they eat is plants all day long, hundreds and hundreds of pounds some days. They do fine. So I would have to say that from my experience, that you can eat as much natural nitrates as you want. But it might help it might help to a certain degree, and then above that might not help. Now, we don't have studies on that. We might say, you eat 5 fruits and vegetables and nuts a day and it helps, but 7 don't. But I don't think 7 will hurt. Jake,
it's weird because
Jake, we did 5 fruits, vegetables. We did 5 a day.
And you're still doing that pretty steadily?
He's not at home, but we try. We try to encourage it. But remember, the problem with nitrates, it's sort of a quick gas, and we can't really measure it. So it's there and gone. It goes away pretty quick.
Right. It was a pretty big deal, as you said, a Nobel Prize.
Yeah, this was a major discovery, because that's what helps control the endothelium, regulates blood vessels, regulates everything. That's why I take a special interest in it, because it's damages to that triggers the disease that I treat with stents and bypasses and everything else. But I want to at least start focusing more on the cause and ways to enhance it, so we don't have to keep doing repeated procedures that damage it. Especially stenting procedures damage the endothelium, causes inflammation, and damages the very thing I'm trying to protect.
Yep, great point. Great point. Oh, thank you, Buddy Lee. He says, thank you both for your great store of knowledge and tonight's presentation.
Buddy sounds like he really knows this stuff, Scott. Sounds like
he's one of our regular visitors.
Well,
you would be amazed at some of our regular visitors and viewers, the questions they ask. I could ask a tough question, but they can ask tougher questions than me.
Well, I wish we had answers to all of them too.
Well, that's exciting and it's challenging at the same time. But yeah. I feel like we're making more progress now in the TOS community than we have since I started, which was more than 20 years ago. We have more connections, more smart people we're meeting who share with us, and everybody has a different opinion, but it's listening to those opinions and considering them that leads to some of these new approaches. So I'm pretty excited. It's really good. We've helped some people. Those success stories are really valuable, because 20 years ago, Jim, I'd have patients coming to me. They'd say, 15 years I've been trying to find a doctor. I don't know what's going on. And it's very frustrating. It should never take that long.
Well, I can see, and I want to hear from our listeners and viewers what they think about us putting together a seminar, a symposium someday. We're in one place. We bring everyone together, share the knowledge, share the stories, and come up with a game plan.
We could do that. I know we could do that. And I think if we invite patients as well as professionals,
let's dream about that.
Right. So TOS education, that's Herb Rep's site. He says we're in. All right. I think we had a question from Freya or Freya. Herb, if you can get me that question back up. Thank you for highlighting the vascular damage due to TOS. My vascular surgeon never talked about it at all. So when you work with different kinds of surgeons, as I know you do, you probably see a broad spectrum of people who, as you said, treat it after the disease is there compared to some other people who consider preventative approaches.
Yeah, it's got to be, you know, you got to take care of the acute problems. And that's what vascular surgeons are great at. They're trained in that. That's what they do. In thoracic outlet, they decompress, they can take the ribs out, they can, you know, decompress certain parts of the body, and they do that. But remember, they're not, just like we weren't trained in some of these things. They're not trained either. They don't have a special interest in it. They don't have a lot of knowledge in it. And that's why it's not passed on. But I'm hoping that someday they say, listen, you know, for instance, Jake's Surgeons now is now showing them Jake's video. All of his patients are seeing the video. All the patients are plugged into that website, and our website plugs into your website. Your knowledge plugs into someone else's knowledge, and that's how it can start disseminating.
And a shout out to Jake Surgeon, because I know he's published before. I had seen his name before I spoke to you the first time. Do you want to mention his name and tell us about him?
Yeah, well, Jake's Surgeon, boy, you'll know his name. I'm just blocking with names right now. You know, it's a bummer getting close to 60 because you can't pull names up as easy. Boy, I'll think of his name in a second here. He's in my group. He's in my group. I should know his name. I saw him yesterday. I should know his name, but I'm blocking right now. But when I come up to his name, boy, you put me on the spot. I'll think of it in a second.
It's me too. I can't remember his name, but I know I've seen him publish something. Is it David?
No, it's not David. It's not David. It's oh boy.
Herb will look it up.
Yeah, Dr. Fide's in our group. Dr. Sprouse is in our group, and the third one in our group he's the only one that does it in our group. Has a special tray. If I talk about it,
Mark Fugate.
Mark Fugate. Oh. Well, now you know that my vascular endothelium in my brain, less is more after a long day, right?
Right, you're just doing too many things.
Yeah, so Mark Fugate, he's much younger than I am, and he's one of our younger vascular surgeons. He trained at Johns Hopkins, so he trained with the surgeon that introduced him, especially to the thoracic outlet, and he got training to do a lot of them, and he's the only one in our area that does this. And we have a special tray, we have special techniques, and basically he's a good surgeon. He knows how to be gentle with the techniques. He knows how to avoid popping the lung, which is one of the side effects. You know, there's two different surgical approaches. There's the anterior approach and this approach here. Of course, we don't want to cut through the pecs if you're an athlete. We want to go to the side. But with that, there's higher chances of hitting the neurovascular bundle. There's more pneumothorax risk. But we chose to do that route. But he's very careful and gentle with tissue. And he is willing, you know, Mark, I talked to him the other day, and he's willing to come in, and I can't give the details of all the things that he's looking for, but he's willing to come on someday, you know, with this site, if you're so interested. He'd be willing to come in and do a talk and answer the detailed questions from the surgical technique, some of the things that they look for. And also, no matter where you're at, how to find a surgeon that might fit you. Mm-hmm. And he can help with that. And someday I think Mark will be willing to help with that. But he trained at Johns Hopkins. We funnel all of the cases of thoracic outlet. And of course, most of them are for the neurogenic form. We funnel all the cases to him in this area. He's the only one knows how to do it. He's the only one with the tray. So we're trying to, and he's probably in his 40s now. Okay. So we're trying to get him as many cases as we can, to do that. And I'm hoping that as these cases grow and our network grows, that we can remotely help with the diagnosis by getting imaging from out there. Now that we have telemedicine and all this electronic data, there's a lot more ways that we can share knowledge and imaging with each other, which is vital too.
We do all of our imaging digitally. We have partners around the country. The patients come in, they get studies, the images get sent to me. I get the reports out to their doctors.
Because I would love to see that would affect the surgical approach. See, that might affect the surgical approach based on the imaging that's done correctly.
Well, I'll share with you because some of our viewers have heard this from me before. And I want to point out Jim Marcum's email address is at the bottom here for everybody. But there are surgeons who use imaging, and there are surgeons who don't use imaging, which fascinates me. There's a particular surgeon, for instance, in Sacramento, Dr. Misty Humphreys, who's at UC Davis, and she's young and she's very proactive, very sharp, and she will do different approaches based on what she sees on the imaging. So I love that. I'll get her reports on patients who have soft tissue anomalies, but no compression between the rib and the clavicle. She'll take a different approach. And I follow up with her a lot so I can learn back what she found during surgery, how the patient is doing. For me, from my point of view, and I realize this is opinion, if I went to see a surgeon and the surgeon said, I don't even want to look at imaging, I know what I'm doing, I would be hesitant. In this day and age, there's nothing we don't image. We overuse imaging.
Yeah.
But unfortunately, scientists are human, and they're not just science. They're human, and they have their biases and dogma. And that's something that will change over time, I believe, as we prove the utility of a multi-specialty approach. As you've said a couple times now, it's not just a radiologist. I don't make 100% diagnosis. It's a combination of people. And that's why TOS, I believe, has been so hard to get our hands around, because we don't have these multi-specialty groups. So that's one of my goals for the future. And that's something that is actually shaping up at present. And I would love to talk to Dr. Fugit, and we'd love to have him on to share that knowledge. Our patients will ask a lot of questions about surgery, be surprisingly facile with the concepts and the anatomy. So that would be great.
Well, I would like to get you two together just so he can understand the importance of imaging, because not everyone has this technology. I mean, it's like we don't have expertise in imaging at our specific site on this situation, because I didn't know much about it until you experience it. So that's why we have to share knowledge and share technology now. The world is a lot smaller than it was when I started 30 years ago.
So true. And we can make things like this happen by getting a doc who's experienced in surgery. If he or she in different cities gets a hold of good physical therapists and good imaging, they can make a huge impact in their community. These patients are out there. Look at Jake. He's the classic example. Young, healthy, overhead athlete, muscular. And we see these. It's a different class of TOS patient from those who get a neck injury in a motor vehicle accident. Completely different class.
And you want to do, Scott, you want to do this right the first time so you don't have long-term sequelae as well.
Find it early, treat it right. Yep.
Yeah.
Absolutely agree with you. I'm going to do a promo here. Here we have somebody asking another question. Type it faster. I love that username. What do you think of the usage of magnesium supplements as part of a daily diet?
Yeah. If you have magnesium deficiencies, I would say, yes, take magnesium supplements. But supplements are for people that have deficiencies. And people that eat a well-balanced diet usually do not have magnesium deficiencies. So that's what I say. If you don't eat it, if your levels are low, you can get that checked with the blood work. The dangerous with too much magnesium is too much of anything can be bad, okay? So if you take too much of it, we use that as a laxative, you can get too much of a good thing. But if you eat a balanced diet, you should have plenty of magnesium. If you're unsure, just get a blood type. But I hope that answers your question. But before we go, I want everyone to go back to the beginning of our talk today and see, I'm going to put everyone on the spot. Can you remember the key words to help us remember today's lecture? Can we remember those? At least one of them, okay?
3 words. 3 terms.
Words. 3 terms. Okay, I'm going to let you think it out loud. But yes, one of the terms was prolonged exposure. Prolonged exposure to toxins, prolonged exposure to good things. So think about that. Less is more. Less of what? Maybe less of strenuous exercise, less of toxins. Sometimes less of good thing is more. And the last way, remember, when you think of the endothelium, think of a highway. And that hopefully will trigger some of the things we talked about today. So as you go out in your world, you can educate people that might need to know more about this.
So Dr. Marcum, it's great to hear you explain something complex in a beautiful way to understand it. I've learned a lot today. Thank you for that.
Okay.
Thank you for your time, and thank you for sharing about, your experience so far with Jake. I know everybody here, as well as myself, wishes Jake, continued, success moving forward with his swimming, but also his health. And you raised a really nice young man. He's really
Thank you.
articulate,
Thank you.
smart, kind of a pure soul. He's just a good
Yeah,
guy.
he's a good guy. If anyone's out in Irvine, California, they have the nationals, senior nationals. He'll be swimming the backstroke. I think he says it's not near San Francisco. Unfortunately, it's down near Los Angeles,
That's
I
too
guess.
bad.
But he's going to be in Irvine next week swimming. So we will hope that he does well, and we'll pray for him. And thank you for everything you've done. You've really helped him in his confidence level. And just to let you know, from talking to you, he's been inspired to join some groups where he's going to help share his testimony with the Fellowship of Christian Athletes. He now has a little more confidence in speaking, so he's going to step up and step out and reach out to other people that might have the same condition and sort of help them steer through these waters.
That is great. And of course, any questions he has, we're always here. If you would share how he does in his swimming, we'll just update his blog post. People, if you haven't seen it on the TOS MRI page, my webpage, our blog is up and running, and one of our blog posts is about Jake, tells his story in a little more detail, and provides links to his great video, which is, again, help4thoracicoutlet.com. Jim Marcum, Dr. Jim Marcum, we put his email up before. Also going to talk about your YouTube channel one more time, Biblical Prescriptions for Life. He covers a lot of subjects with just plain old common sense, just the style he demonstrated here. Takes complex subjects and boils them down so that we can understand them, even if it's totally out of our field. And I highly recommend it. Our event coming up in a couple weeks is going to be the anatomy of thoracic outlet syndrome. The anterior scalene muscle is the key to TOS. Herb, who's doing that speaking? I believe that's me. So I'm going to promote myself, and I hope it's a good talk. I'm going to hold the speaker responsible. Jim, thank you for sharing. Really appreciate your time. I appreciate learning more about what you taught us, but also about you and your family. So thank you very much.
My pleasure. We'll be in touch. And next time we're in San Francisco, we're going to take you out to dinner. And we're going to have a salad.
It'll be great to see you in person. All right. Okay. So anyway, I'm Dr. Scott Worden, the TOS guy. Come and visit toseducation.org to see our latest videos. And tosmri.com is all about TOS. You can contact us there for any help finding TOS specialists, asking questions about TOS. We're here to help. Everybody out there, stay healthy, stay safe. Thank you.